COVID-19 SARS-CoV-2 variant classifications and definitions. Genetic variants of SARS-CoV-2 have been emerging and circulating around the world throughout the COVID-19 pandemic. Viral mutations and variants in the United States are routinely monitored through sequence-based surveillance, laboratory studies, and epidemiological investigations. A U.S. government interagency group developed a variant classification scheme that defines 3 classes of SARS-CoV-2 variants. The classes are a variant of interest, variant of concern, and variant of high consequence. The alpha, beta, gamma, epsilon, and delta variants circulating in the United States are classified as variants of concern. To date, no variants of high consequence have been identified in the United States. Laboratory studies suggest specific monoclonal antibody treatments may be less effective for treating cases of COVID-19 caused by variants with certain substitutions or combinations of substitutions in the spike protein. Viruses constantly change through mutation. A variant has one or more mutations that differentiate it from other variants in circulation. As expected, multiple variants of SARS-CoV-2 have been documented in the United States and globally throughout this pandemic. To inform local outbreak investigations and understand national trends, scientists compare genetic differences between viruses to identify variants and how they are related to each other. Variant classifications. The U.S. Department of Health and Human Services established a SARS-CoV-2 interagency group to improve coordination among the Centers for Disease Control and Prevention, the National Institutes of Health, Food and Drug Administration, Biomedical Advanced Research and Development Authority, and the Department of Defense. This interagency group is focused on the rapid characterization of emerging variants and actively monitors their potential impact on critical SARS-CoV-2 countermeasures, including vaccines, therapeutics, and diagnostics. Variants of interest view current variants of concern and variants of high consequence. Note that each classification of variant includes the possible attributes of lower classes. Variant status might escalate or de-escalate based on scientific evidence. WHO also classifies variant viruses as variants of concern and variants of interest. U.S. classifications may differ from those of WHO since the importance of variants may differ by location. To assist the public discussions of variants, WHO proposed using labels consisting of the Greek alphabet, alpha, beta, gamma, as a practical way to discuss variants by non-specific audiences. Variant of interest. A variant with specific genetic markers that have been associated with changes to receptor binding, reduced neutralization by antibodies generated against previous infection or vaccination, reduced efficacy of treatments, potential diagnostic impact, or predicted increase in transmissibility by disease severity. Possible attributes of a variant of interest. Specific genetic markers that are predicted to affect transmission, diagnostics, therapeutics, or immune escape. Evidence that it is the cause of an increased proportion of cases or unique outbreak clusters. Limited prevalence or expansion in the U.S. or in other countries. A variant of interest might require one or more appropriate public health actions, including enhanced sequence surveillance, enhanced laboratory characterization, or epidemiological investigations to assess how easily the virus spreads to others, the severity of disease, the efficacy of therapeutics, and whether currently authorized vaccines offer protection. Current variants of interest in the United States that are being monitored and characterized are listed below. Variant of concern. A variant for which there is evidence of an increase in transmissibility, more severe disease, for example, increased hospitalizations or deaths, significant reduction in neutralization by antibodies generated during previous infection or vaccination, reduced effectiveness of treatments or vaccines, or diagnostic detection failures. Possible attributes of a variant of concern. In addition to the possible attributes of a variant of interest, evidence of impact on diagnostics, treatments, or vaccines, widespread interference with diagnostic test targets, evidence of substantially decreased susceptibility to one or more class of therapies, evidence of significant decreased neutralization by antibodies generated during previous infection or vaccination, evidence of reduced vaccine-induced protection from severe disease, evidence of increased transmissibility, evidence of increased disease severity. Variants of concern might require one or more appropriate public health actions, such as notification to WHO under the international health regulations, reporting to CDC local or regional efforts to control spread, increased testing or research to determine the effectiveness of vaccines and treatments against the variant. Based on the characteristics of the variant, additional considerations may include the development of new diagnostics or the modification of vaccines or treatments. Current variants of concern in the United States that are being closely monitored and characterized by federal agencies are included in the table below. The table will be updated when a new variant of concern is identified. The Alpha variant, first identified in the UK, the attributes is approximately 50% increased transmission, potential increased severity based on hospitalization and case fatality rates, no impact on susceptibility to EUA monoclonal antibody treatments, and minimal impact on neutralization by convalescent and post-vaccination sera. The Beta variant, first identified in South Africa, its attributes are approximately 50% increased transmission, significantly reduced susceptibility to the combination of monoclonal antibody treatment, but other EUA monoclonal antibody treatments are available, and a reduced neutralization by convalescent and post-vaccination sera. Epsilon, first identified in the United States, about a 20% increase in transmission, a modest decrease in susceptibility to the combination of antibodies. However, the clinical implications of this decrease are not known. Alternative monoclonal antibody treatments are available. There is a reduced neutralization by convalescent and post-vaccination sera. The Epsilon variant, identified in the United States, California, 20% increased transmission, reduced susceptibility to the combination of monoclonal antibodies. However, the clinical implications of this disease decrease are not known, and alternative monoclonal antibody treatments are available. There's a reduced neutralization by convalescence and post-vaccination sera. The Delta variant, first identified in India. The attributes include an increased transmissibility, the potential reduction in neutralization by some EUA monoclonal antibody treatments, and the potential reduction in neutralization by post-vaccination sera.